in consideration of its own people and leading and providing leadership in how healthcare should be provided. This does not mean that we are where we want to be. It nonetheless suggests that good progress has been made, even though a lot still needs to be done. The need to upgrade our level of preparedness should not lay focus on physical infrastructure alone, but also human resource capacity, as well as the level of compliance with the containment measures of our people. In today's briefing, Dr. Mulwa took us through the training that has been going on in this county, and I want to congratulate you, Dr. for all the good work you're doing, and I want to congratulate all the health workers who are here standing in front of us. Feel appreciated, we care for you, and we want you to continue in the same spirit. We understand how much you are giving, and we want you to know that we don't take it for granted. We appreciate the work that you are doing. The need to upgrade our level of preparedness should not lay focus, as I said, on just the buildings. We have got beautiful buildings, but without these people, these buildings are completely useless. So I want the people to feel that you first, then the buildings, as it should be. But the mental readiness of individuals to follow directives, as we have given in the containment measures, is also critical. This is because, as stated, this disease cannot be fought by the government alone without the cooperation of the people. Each and every one of us has a role to play in ensuring the containment measures advocated by the government are observed. This is the only way that we can possibly suppress this virus. Ladies and gentlemen, fellow Kenyans, we are now dealing with a virus that is well established at the community level. All counties, except 5 of them, have reported cases of COVID-19. It may be realistic then to state that it will be just a matter of time before all the 47 counties are affected. We hope and pray that it doesn't happen. But we are also realistic enough to appreciate that post the cessation of movement from Mombasa, Nairobi, and other counties, it may be just a matter of time. With this knowledge, we must take every action to limit the further spread of the disease in each county, without which our healthcare facilities risk being overwhelmed. Looking at the caseloads in the country at the moment, we have some 8,528 people who have contacted the virus. Out of this number, 44 are from Makueni County, from a sample size of 299. It is important to note that among those already exposed to the virus are our healthcare workers, who continue to work under difficult conditions and circumstances, as they also offer crucial service to our people. Currently, 257 healthcare workers have fallen victim to this virus. It is unfortunate that 4 out of this number are also from Makueni County. For all those who have been exposed, I want to assure them that the government is committed to ensuring that all our frontline soldiers are protected at all times by making available the necessary PPEs and other commodities. I therefore want to take this opportunity to thank all healthcare workers for putting their lives at risk as they manage our patients. There can never be a higher calling by an individual than what you are currently doing. As a nation, we are indebted to you. The total number of infections in this county places Makueni at number 12 overall. This is not a modest number, and it can change. This is a modest number, but it can change, particularly now that restrictions of movement in and out of Nairobi and Mombasa have been lifted. I'm glad that Makueni County has embraced the issue of home-based care protocols, recently launched by my ministry. in which asymptomatic cases are cared for at home. Here in Makueni, there are 5 patients who have been enrolled on this program, and I'm glad to note that they are all doing very well. Those home-based care protocols can only be effective if every one of us takes personal responsibility observing them. They must be complied with together with the containment measures, which include that you maintain social distances, social and physical distances when somebody is that condition, the continuing and continuous washing of hands, the wearing of masks at all times, avoiding all forms of gatherings, and using sanitizers where appropriate. Fellow Kenyans, as I earlier stated, my ministry will continue to work very closely with counties to upscale their level of readiness to deal with this pandemic. We have hired some 252 healthcare personnel of all cadres to boost human resource capacity, while the process of hiring another 110 is ongoing. I'm still delighted that the county government of Makueni has also achieved the 300-bed isolation capacity in line with the directive given by His Excellency the President. Congratulations to the Makueni government. In fact, from this morning's discussions, Makueni is actually waiting to upscale its capacity not only from 300 to somewhere close to 800. And I think that is really, really leadership, if I ever saw leadership amongst the counties. Congratulations and well done. Alongside this isolation facility capacity are also ICU beds, HDU beds, and quarantine facilities as part of the county preparedness. I want to congratulate you once again on your achievements. As we work to upgrade our facilities, we must remind ourselves that prevention is always and has always been better than cure. Let us all embrace the containment measures in order for this to be what is effective and in place. At our current COVID-19 situation, we have 278 people who have tested positive in the last 24 hours from a sample of 3,053. Ran over the last only 24 hours, I repeat, 278 people. Now this brings our total to what I said earlier, 8,528, and we have a total now of 196,508 samples tested so far, nearing and heading for the 200,000 samples figure. I'm delighted to inform you that today, 89 patients have been discharged from various hospitals, bringing once again that total to 2,593. I want to thank our healthcare workers once again for their dedication and commitment to duty, which makes this healing possible. Sadly, we have also lost 2 patients to the disease, bringing our fatality to 169. Our heartfelt condolences to the families and friends who have lost their loved ones. As I conclude, let me emphasize the importance of collaboration in this fight. As the ministry, we have received tremendous support from different individuals and organizations, both public and private. The logistical resources needed to get us where we are today have been enormous, and out of their goodwill, we can confidently say that we are in a much better position at our level of readiness. I particularly want to thank the Kenya Medical Training College, KMTC, who have, and the chairman and the board members are here, right there, Mr. Kaloki. Thank you very much indeed for your support, and the entire board of KMTC, who have offered 40 of their facilities to be utilized as quarantine facilities. One such facility is at Makindu here in Makueni County, which has been converted to a 300-bed capacity for COVID-19 isolation and treatment center. I thank the leadership of KMTC for this collaboration. Finally, I want to express my gratitude to thank Governor Kifutha Kibwana and the people of Makueni for your continued dedication to matters healthcare and your hospitality. I've been impressed by the level of readiness and your cooperation in fighting this pandemic. I want to thank the County Commissioner and the administration for showing good cooperation between the county government and the national government. This cooperation between the governor, the county commissioner, who are both the co-chairs of the National Emergency Response Committee on COVID-19, is what is working well. And I am also happy that the county commissioner has been in the forefront of ensuring that enforcement takes effect, because without enforcement, unfortunately, we cannot succeed in everything else that we are doing. Of particular importance is to keep the measures that have been given. Curfew has not been lifted, so it must be continued. As well, in addition to curfew, is also the closure of entertainment places such as bars, because in those areas, this is where social distancing does not take place. This is where you will find that people get close. And the question has always been, if people are not maintaining social distances when they are sober, how do they do it after kanywaji? And then you understand that that is a difficult call. So thank you very much, County Commissioner and the enforcement agencies, for your good work. So, ladies and gentlemen, ningetaka tu kuongeza kidogo, niseme ya kwamba wananchi wa Makueni, ningetaka kuwashukuru kwa ile kazi mzuri mnaendelea kufanya mkiongozwa na His Excellency the Governor na pia the Deputy Governor, marafiki wangu wote. Sisi kama Ministry of Health, Wizara ya Afya, tunashukuru wale pia wako hapa katika wanafanya kazi, tunawaita wa front soldiers, wafanyikazi wa mahospitali na clinics na kwingineo ambao mnaendelea kulinda wananchi na ile kazi mnafanya nyinyi. Kwa hivyo, I just want to say, nyinyi watu wa Makueni, muendelee hivyo hivyo. So far so good. Your figures are low. Let's keep them there. Let's keep them at that level. That's what we want to see. Lakini ni lazima kila mtu achukue jukumu lake la kulinda yule mwingine. Hii kazi sasa sio ya serikali. Toka juzi Rais Uhuru Kenyatta alisema ni lazima sasa kila mtu awe ndio anashunga mwenzake. Wewe ndio unashunga rafiki yako pia ndio anakushunga na kukulinda. Tukienda nyumbani, nahimiza watu wetu sana wale wako Nairobi, wakifika hapa ama wako Mombasa, kwa sababu huko virusi imeenea zaidi. Wale ambao wanatoka Nairobi na Mombasa, mkifika hapa Makueni, tafadhalini we kuja na mask, ukuje na sanitizer, badala ya kupatia mama unga peke yake na mzee umletee shati. Ndio mletee shati, ni vizuri sana, anataka hiyo shati, lakini vile vile mletee sanitizer na umpatie mask, kwa sababu atajilinda na hiyo mask na hiyo sanitizer. Na sana sana ikiwezekana msikuje. Sindio jameni? Kama inawezekana. Tunasema mkitaka kuja, kujeni, ilani ikiwa ni lazima wewe kuja. Lakini kuja ukijua hapa kuna wenyewe. Na wenyewe hawataki kufa. Wanataka kuishi, sindio jameni? Kwa hivyo watu wakija, waje wakiwa wamejitayarisha kufuata masharti yale ambao imewekwa na county government na pia serikali kuu. Kila mundu esovie. Hao ni chao. Diwo, jameni. Kwa hivyo nataka kushukuru sana. Vile vile Deputy Governor, wakati tulipokuja, hatukuja mkono tupu. Tulikuja pia tutamletea, iko hapa tumekuja nazo. Tuna 3 ventilators. Dr. Mulo, you'll be happy to hear that. Pengine atamueleza ventilator ni kitu gani, mtu akishindwa na kifua ikijaa liquids. Si ndio? Daktari, wajua siku hizi hata mimi ni community health worker. Number 1, naelewa hii mambo kidogo. Kwa hivyo Makueni County leo tumemletea, kwa sababu ya wafanyakazi sana sana, tunamletea 50,000 protective gloves for the health workers here. We also came with us with some 8,750 medical shoe covers, again for our health workers. We have got some 500 KN95 masks for them again. Some 1,200 and or so face masks and coverall medical gowns, at least 50 of them. We also have about 500 goggles for the 125 goggles for our medical workers. So we want to make sure that you are protected and that you continue, so that you can continue giving the work, doing the work that you are doing. At this juncture, Kano, I can take 1 or 2 questions.
Thank you so much, Mheshimiwa Waziri, Deputy Governor, wananchi wote watukufu ambao wako hapa. Ni wakati wa kuuliza maswali kwa waandishi wa habari. Unapopata muda wa kuuliza maswali, naomba useme jina lako na kitu ambacho unawakilisha, na ziwe fupi. Wa kwanza nani? Please.
Thank you.
Ucio auma Minister wa ugima wa mwiri kaunti-ini ya Makueni akiruta ndumiriri yake egie uhoro wa coronavirus kana kuhurana na king'uki giki gia COVID-19 na akorwo agicokeria ngatho utongoria kana atongoria a Makueni akorwo akiuga ni mehaririirie wega muno na ni makoretwo mena makiria ya mariri 300 maria mangikorwo magitangikira andu aria mehatikaini nimo ma ICU na HDU, na agikorwo akiuga ati ni aracokeria ngatho cukuru ya urigitani ya KMTC no tongoria wayo ni uri koretwo igiteithia thirikari nene na gukorwo ikiiga andu keheri-ini na kumatangikira. Na coka akiuga makanitha na ateterithia makanitha ni metikiritio gukorwo mahinguritwo, no etikia makorwo magitikira gukorwo mari igana rimwe tu. No horo wa ba auga hau ndari ena nganja hanini ati arefi no makorwo hihi magikorwo makiiga magika uria kwagirire. Acokeria ngatho nauga andu othe na utongoria wothe wa county ya Makueni, na ateterithia kuga ati ona angikorwo mukana ni urarutirwo ni President Uhuru Kenyatta wa kumana kuingira county-ini cia Nairobi, Mandera na Mombasa, wigiririki ni wa Mukenya o wothe na makiria muno gukorwo tukigitanira na kugitira andu aria akuru. Njitagwo Mubii wa Wanyoike, ndugamite haha ni undu wa gukurehera mohoro gitau na mwathiriri na njira ya cikwetagwo Wagaki wa Muthoni, na tukwambiriria mohoro maitu muthenya wa muthi na guthii nginya county-ini ya Laikipia kuria ahuri biashara kiheri kuma tauni ya Nyahururu county-ini ya Laikipia maratara hathara ya makirima besha thutha wa nene cia mwaki kuhofaniria nyumba iria maigaga indo ciao utuku wa gukio muthi. Kiumo kia mwaki ucio gitire kiramenyeka ende uthuthuria no wambikitwo. Nduta wanyu the niwe wina ripoti ino makiria.
Ni muingi kanini na kanene makigeria kuhoria mwaki uria ugomeire nyumba cia kuiga indo cia wonjoria itanyiheire 10 utuku wa thaa 5 tauni ya Nyahururu kaunti-ini ya Laikipia. Kuringana na muingi uria uguteithagiriria hari kuhoria mwaki ni worotete ngari ya thima moto ya kaunti no makiuga na gutuika ni irakinyire ihinda riria riagiriire guti uteithio ra mateithirie ni undu wa kwaga kihura mai ni racungiririo gucoka. Ndetwerera rakaririe muingi na njira nene.
Bwana Governor, mimi nakuomba gari ambao umetuletea hapa kama zimamoto, sisi kama wana Nyahururu huwa tunatoa pesa mingi over 200 million per day ambazo ni ushuru wetu, lakini gari haina maji. Na mimi naomba kitu kimoja, wewe kama governor kuja utupiganie sisi hapa. kunachomeka na ni watoto wetu wanachomekea hapo, mimi nikiwa mmoja wao.
Na kumana na ndeto eno muingi no rathingata thirikari ino ya kaunti itikire kuiga ngari ino na ikiro iria ciagireire niguo gutigirira ni yang'ethanira na mogwati ta maya hindi iria meyumiria.
Ngienda atiriri gavana witu wa Laikipia akorwo oe gukuti na ngari ya mwaki ni matondu korwo ikuo mwaki undu ngiahana uu ni twaigua sorry ni undu wa mwaki ukuhe ngari ya mwaki irungie hau
kiuyo na haria ngari ino yuma nitamakinya nitamita 10 na yoka tari mwaki hatiri kindu matoe turauma tonini
mari na kigiriko kiingi onjoria marauga matungitwo ni hathara nene uu ati mararigwo makurora nako kuona matinahota kuhonokia ona kikumana na nembe nene cia mwaki riu makienda gukorwo magithaitirwo ni thirikari ya kaunti ino itemini ria kumahura njeki niguo nari monekana ni megucokereria
riu tungiwa gavana arore maundu maya ona akorwo gwika ati na andu aya marore ma compensate makire hathara yo mathie tondu oneo ma fail ta thikari
andu aya marahirwo ri ni megutwika compensated na county ya Laikipia ri itwike answerable hari kumenya maundu maya uria meguikara na ngari yo tondu ni itu ithondekwo.
Kihumo kia mwaki ucio gitire kiramenyekana indi uthuthuria wa naihenya ni wambikitwo handu-ini ha Kameme TV getwo Nduta Wanyuthe.
Tugithie na mbere aciari ni makenereire itua ria thirikari kuhitukira ministry ya githomo ria kugutha kana ria kuga ati mathukuru macokeria aciari mbeca iria marihite cia tamu ya keri na ya gatatu kuona ciana cigukorwo cigeikara micii. Mwandiki witu wa Boi wa Mwangi ari na mwena aciari acio akiaraniria nao reke riu tunyitanire nake na njira yemwe kwa mwe tumenyithio ria kurathie na mbere. Wa Boi ngwihoka ni uranyamukira wega na no murathie na mbere na kuimenyerera mwena ucio wa Murang'a kahinda gaka ni gaku utwire uria aciari a mwena ucio marauga.
Ni wega muno na guku kaunti ya Murang'a no thumbi na ruhuho na tutianangite turaraniria na aciari ogwata arutani uhoro wigie gukorwo magicokia magieterera gucokia ciana cukuru kuona minister wa githomo Professor George Magoha ni araniriria rauga ati githomo gikahingurwo mwaka turorete wa 2021 na umuthi ni arekia ndumiriri oiga muciari wothe urarihite fithi ya tamu ya keri na ya gatatu ni aria marihite mwaka mugima makorwo magicokerio mbeca ciao. Reke tunyitanire nao imwe kwa imwe matuhe mawoni mao megie ciana gukorwo cigeikara mucii na ningi muno makiria horo cio wigie gucokerio mbeca. Tukwambiriria nawe baba itu nguhiriria haha ukorora haria guku ni gwa Kameme TV na njira nguhiritwa ria kuna mawoni maku megie macukuru.
Ndita rakwa njitagwo Julius Waithaka na ndi guku Murang'a njikaraga guku Mukuyu. Reke njuge uguo Professor Magoha araigire Minister wa Education ni araugire wega muno na ni arekire wega tondu horo wa ciana gucoka cukuru na murimu no guthie urathie na mbere utambite heno gwati munene muno tondu kuu ni ta kuga uikie gikuo ndahi ndungimenya uria guguthie na mbere koguo ni kwagiriire ciana ikoro ci mucii ona akoro ni mekurirwo kuu ti kurirwo tondu ugima wa mwiri na wa ciana wina bata muno ona gukira githomo. Acio mararihite mwaka muhimwa no njuge uguo waziri aiga ni wega muno tondu muciari arihaga mwaka nigetha eninire thina na ringi akoragwo mbeca icio akobete koguo ni ngona kwagiriire tondu mahuthirite tuge tamu imwe mbeca icio macokerio tondu muciari ucio nowe ukariha mwaka uyu ungi ugoka koguo ni kihoto kwagiriire muciari ucio rihite acokerio.
Reka tunyitanire na mwarimu wi haha nigetha akorwo agitutariria ni mwarimu wa thukuru ya muthingi guku mwena wa Murang'a kinya haha mama Faith kurora haria ritwa riaku na utwire mawoni maku wenda igwo kinjira wina mwana urariheire mwaka mugima na minister ni auga mucokerio mbeca hihi ni murona undu cio tokuonekana kana ene macukuru ni matumirire mbeca icio.
Njitagwo mama Faith na ndi mwarimu na nigenete no ni cio wa thirikari na koguo niguo professor iga thena ni ndakena ni tondu ndona mena meciria maciari na ni ngugitikia thukuru the heads of the schools uguo niguo magwika no thina wakwa munene ni ati tondu twakirite kuma January ni gukiuga ciana cigicoka ri tugicoke cicokio thutha kuma January na alternatively ni magwitwo advice no nyende kuga ati oguo professor Iga uhoro cio ndugwekirirwo muhuthia ni maciari ni marorwo muno tondu no makariha nginya next year na njokirie thirikari ngatho muno ni undu wa gwiciria mwana wa Kenya uhoro cio wa covid ti uhoro wa itheru na kiria kina bata muno ni health ya mwana. Health comes first. Kungiko ni maronire wega thukuru iri schedule the schools to be rescheduled up to January tuti no tungiona tugire ni wega na waciari turi mucio uguo thirikari yatwiciria wega na ithu turi aciari tuthi na mbere na gwiciria ciana citu wega ri ni ihinda ria kumarora wega muno kuma advice oro wa covid ri ihinda ria kurura ciana imenyithio holiday ri ni extension ya ni ndu ria kuhana ko tuni ciana citu mitugo miega tumathomithie wega akorwo ni mabuku tuikare tukimaririkanagia na mitugo miega ona maririkanio na nigetha tuhote gwithema king'uki kia covid na king'uki gia ciana ciithitu kugia mahutene.
Kanjira atiriri utanarikia ni mukuona ene cukuru ta makuona mbeca ici tondu kaingi ni muwi mbeca citigikaga no korwo hihi ni mathire magici invest kundu kungi ni mukuona mbeca ici ta cikuoneka kana mekuga ni mahuthirite.
Ni ngwenda gwiciria ni maigite mbeca icio tondu ni kuga ona ko gutinoka covid thukuru no ingiracokirwo na koguo mbeca icio no cingirahuthirwo koguo ni twenda gwiciria ni macigite handu hega na gutikagea na ngucanio tondu naguo ugi wa thirikari wathomunya nginya kahua angikorwo uguo niguo watho wa thirikari uroiga ri then I think everybody should go by that. Koguo ithuĩ aciari tũrĩ akenu mũno.
Thank you. Aya ucio ni woni wa aciari a guku Murang'a o ũndũ ũmwe na arutani na nĩ waigua nĩ marakiuga atĩ nĩ wega nĩ maiyũkia ũrĩa waziri wa gĩthomo ũgwĩtwo Professor George Magoha oiga makorwo magicokerio mbeca ciao to cio arauga arĩhĩte mwaka mũgima na nĩ mwĩhoko witũ atĩ ene macukuru thukuru cia mũthingi thukuru cia secondary othe nĩ magũkorwo magĩtĩkania na Professor Magoha na makorwo magicokeria aciari mbeca ciao. Handũ-inĩ ha mũhũri mbica witũ Alfred Maina wakĩigua kamũhũa ngunyĩra nĩguo ngururĩrie na ngũthererie tondu gaka nĩ kanya kohoro kuma metumi ndigi magũrũ ritwa riakwa no Wambui Mwangi wa Wokabi.
Ngatho muno Wambui wa Mwangi na Alfred Maina mwena ucio wa Murang'a ni undu wa gwiturehera riboti iyo. Tugithie na mbere tuthie riu nginya Embu kuria makinya mahiu ma kiwatho ni megukorwo magikinyirio marigitari na macifu aria makoretwo magitwarithia na mbere ugimarithia wa iretu guku bururi-ini na makiria mahinda-ini maya thukuru ihingitwo. Murugamo uyu rutitwo ni mutafariri wa mihango ya Ministry ya Gender Rachel Shebesh hindi ya gikaro thukuru-ini wa Kenya School of Government county-ini ya Embu akiuga matigukorwo makiunira maitho aria mekunyitikana na mahitia maya na Wambui wa Maina Wambui wa Njuguna niwe wina riboti ino makiria.
Akiaria hindi ya gikaro thukuru-ini wa Kenya School of Government county-ini ya Embu mutafariri wa mihango Ministry-ini ya Gender Rachel Shebesh augite ni megukorwo making'ethanira kiwatho na marigitari hamwe na macifu aria makoretwo magitikiria ugimarithia wa airetu ukorwo ugitwarithio na mbere.
Parents are going to be arrested because they need to know. Cutters will be arrested. Any provincial administration or police that is complacent on that issue will be arrested. If it is medicalization, we will close that clinic. We will arrest that nurse, doctor, former nurse.
Shebesh augite ni wuigiririki wa thirikari gutigirira mwana wa muiretu ni agitirwo na njira iria yagiriire guku akiuga thirikari ni gukorwo ikinyitanira na atongoria a makanitha hamwe na matura hari kuhurana na mbara ino.
Our fundamental work as government and the president is to protect the girl child. To protect the girl child, just the same way he has to protect the whole country, the whole society.
Muikariri gite wa ruhonge rwa kuhurana na ugimarithia wa airetu Agnes Pareyo augite macifu nio mari na uigiririki munene na matigukorwo makirica guoko kwa watho wona manyitikana makihithirira aria maratabania ciiko ici.
We have the Children's Act, we have the Act of Parliament, they are all there, but it's like FGM has not really moved.
Mwena-ini wake kamishna wa kaunti ya Embu Abdullahi Galgal augite thirikari ya kaunti ni hariirie kuigana na ni hotorete kuhurana na mbara ya ugimarithia wa airetu nginyagia muthia wayo.
We wouldn't wish to have any girl get pregnant in Embu County or the country as at large.
Handu-ini ha Kameme TV ritwa riakwa ni Wambui wa Njuguna.
Tugithie na mbere, thirikari ya kaunti ya Naikuru nitanyete guthurima murimu wa COVID-19 gatagati ka andu aria mendagia irio, kuria itanyete gukorwo igithima andu matanyihire 60,000 ikinya riri riguka kurumirira gucokereria kwa mihang'o bururi-ini. Gukinyithia riu andu 4,000 icigo-ini cia Moro, Naikuru na Girigiri ni marikitie guthurimwo. Riboti ino ihaririirio ni Muringi wa Ngure.
Mihang'o ya guthurima andu aria mendagia irio gicigo-ini kia mbunge kia Naivasha kaunti-ini ya Naikuru yambiriirio umuthi ari ta tabarĩra ya kaunti ya Naikuru ya gutigirira aria mendagia irio mari na ugima wa mwiri na matiri ugwati-ini wa kunyitwo ni homa ya coronavirus,
ili tujue hali ya ugonjwa imesecurity aje Naivasha.
Kuringana na dagitari munene thibitari-ini wa Naivasha, mihang'o ino ni kumahotithia gwika ithabu ria andu aria mahutitio ni homa ya COVID kaunti-ini ya Naikuru.
Targeted testing means the people who you deem to be at risk, you test a group of them. It's not representative of the whole group of them, but it will give us an idea just how what kind of measures we need to take next.
Murugamiriri wa ugima wa mwiri wa muingi gicigo-ini giki augite marikia guthurima aruti a wira mikawa-ini ni magukorwo makihe muingi uria uri biacara-ini ingi mweke wa guthurimwo na kumenya uria ugima wao wa mwiri utari.
We are targeting not really the hoteliers or truck drivers, but the community of Naivasha, because it's just a targeted surveillance. But of course, you know, most of the people live in Naivasha are hoteliers. Others are truck drivers, and others are doing the other part. But we gradually will even streamline to various sectors.
Akiaria ciegi matereba aria monekanite gukorwo na murimu ucio, augite mihang'o ya kwararamia wadi cia arwaru acio no irathie na mbere. Kaunti ya Naikuru itanyite guthurima aruti a wira 60,000 aria mendagia irio cia kuria ndeto iria iheanitwo ni murugamiriri munene wa ugima wa mwiri wa muingi kaunti-ini ya Naikuru na njira ya thimu, kuria augite kaunti ya Naikuru ni imwe ya iria iri na mikawa igatu guku bururi-ini. Ngeribotera Kameme TV, njitagwo Muringi wa Ngure.
Tugikara o kaunti-ini ya Naikuru ni ati ministry ya ugima wa muingi unyitaniri-ini na atarani kuma kaunti-ini ya Naikuru mari na mubango wa kuheana motaro kuri gatagati ka arutwo a kirathi kia 7 nikio class 7 na form 3 kana form 4 itemine ria kumathara kumana na ciiko cia uhaguku wa mitugo na wohi wa nda mari anini. Mwandiki witu wa Ng'ombe wa Maina ari kigomana-ini giki na riu reke tunyitanire nake na njira yemwe kwemwe. Wa Ng'ombe, ngwihoka ni uranyamukira wega kuma mwena uyu wa studio. Mwaro uyu ni waku uturi uhoro uyu wa utarani wa arutwo.
kana mubango uri wakorwo kihanika o riri gukoretwo na wongerereku wa ciiko cia ciana nini gukorwo ikiohanda kana gukorwo ciri na ciana nini cia iritu gukorwo ikiohanda na mubango mugima no urehetwo muno wa Kivumbi-ini no ni Naikuru irathiro ni uria ukoretwo ukirongoreria ciana nini cia iritu ndo mona cia tuhui ni ukumathaitira kumana no tugwarikia gutema mubango kwa mitugo oro undu umwe na ohi wa nda maria nini no ngejitikie nigetha tukorwo tukimenya ndeto no wega njitikire ngũngenyitana aria makoretwo maharĩrĩirie mubango uyu makorwo makimenyire ndeto ino yothe kana mubango wothe uria makorwo magitwarithia maragũkorwo magĩtwarithia ihinda rigana atĩ na nĩkĩ gĩkĩ gĩcũngĩrĩirie na njĩra nene gũkorwo makĩanjĩrĩria matũra-inĩ ma tũkĩnjĩra mũthuri hao ũkĩmenyithie rĩtwa rĩaku no ũkĩmenyithie ciana ici mũkoretwo mũcikinyĩrĩte na njĩra ihana atĩa na makĩria ona mũgĩthiĩ na mbere na mũbango wa kũmatara nĩ mwakorwo mũgĩkĩra mataro ma thirikari harĩ gũthaitĩra gũtherema kwa homa ya COVID-19.
Asante sana ndacokia ngatho njĩtagwo majĩtagwo Teacher Moses na ndĩ mũtari na ndutaga wĩra wa gũtara ciana hasa aya adolescents. Tuma na mafundisho ma class 7 na class 8 na form 1. Nitwathikira mawatho mothe ma ministry ma kuiga social distance na gwithamba moko matokete kũ thĩinĩ na magwithamba moko na maikara thĩ twaje kumafundithia maũndũ marĩa marekĩka. Mũtao nĩ mũtao wa Kivumbi-ini na kwĩna ciana nyingĩ mũno iria mendaga-inĩ cia kũrebia angĩ mena arata matarĩ na mwelekeo angĩ mokĩte maruzĩte hope maica-inĩ mao. Rĩu matirĩ cukuru-inĩ, gũtirĩ mũrara mabundithia, gũtirĩ tuition na matirathi kanitha tondu nume 13 years matirathi kanitha ndona haweka mwanya kwa ciana kura tora ciana ici citora me program ini ici cia program ni what supposed to happen iko tumura ara ya kido so there's a lot of sexual immorality nikorona ciana nyingi cira mahu agena waraga na STD na tokete guku kumafundithia this is the first program tweka baada ya shukuru kuhigwo na ntukorona yo me shukuru-ini tumirehete macinani-ini nigo mahote gufundithio
na hihi aciari marako makiukia mubango ati ni muko tumukene na aciari a ciana ici na marako makiukia ndetonete na murako mugikuruhania aciari nigo kuona ti nyimwe ko mukinyitana nao haha kore mucini mere cokerera aciari ni murakuruhania aciari
kwa gucokeria ngatho aciari a Kivumbini ni metikire ciana cio cike guku mataro ni kuga atiriri ni marona kuna thina na tondu thina no wekuo twatara ciana ici tumaguko ciana ici turathi kwa aciari no makaciari mamiciara cio cibundithitio atia nigo matigathi gutharuria maundu maria tubundithitio guku tondu aciari no makao ni stakeholders na turamakinyira
Murori wa Kameme TV ungejitikira kugindana na umwe wa aciari aria megwikinyite giko-ini kina korwo kimenyite tukiuria kimwe tu na njira ya naihenya niki giki kionekana ta aciari na ciana toko tukiraihaniria kana hatari na unyitaniri wa ureri niki ni muciari kana ciana iria genyukite no ina wa kuorotwo haha
ni hamaritwa njitagwo Ruth Wanjiko ndi ciaredi wa Kivumbini oversight ni ithuĩ tuorganizite mukutano wa ciana tundrona ciana nyingi ni kuria cirorira njira ciana ici ni ciragia mau cirĩ nini cikaingĩrĩra drugs cirĩ nini na twita muciari ithuĩ tutete makinya according na ciana citũ na ciana ici ciĩna muda mũraihu mũno wa gũikara mũciĩ tondũ igacoka cukuru January ingĩakororwo ciana ici nyingĩ nĩ iria cikũrĩra matũra-inĩ
ritana riaku kuri muciari thukuru ni irakorwo gutika igakorwo ikihingurwo mwaka turorete iyo ni mieri igana na mucii na ciana na nona mieri irakorwo maikara mucii uria maundu mako mahana ritana riaku kuri muciari wothe wina mwana munini na makire muno aya mari mathukuru
ni ritana riakwa he muciari especially mwana wa kahĩ na kairitu ni ndita muciari aria me mĩciĩ-inĩ yao ni ngui mahoya ona mwana wakwa kiumagaraga menyaga kuria arathie mwana ucio muhe nginya homework ya nyumba gwakorwo kimu cancel na mwana ucio akudekurira thi na twahoya government okona ihote gutu support na program ino itu tutikumininira haha na nitugwita nginya aciari ao enyewe tumenya tukumariria uria mekuhandle ciana uria mekuhota kumatungata wega
Muroreri wa Kameme TV na mundu gwitwo Mubi wa Wanyoike ni waiguira ni ndeto ngimerera korwo githi na mbere na kiria gikianjiria muitu riria Kivumbini na riria rikoretwo rikiorotwo na njira nene muno nginya ni honge cia ugiteri kumana na uhaguku wa mitugo wa ciana na korwo na gikundi gikire mukana gia confirm na gikorwo gikiagagia muingi wa town ino ya Naikuru hihi mubango to ni ukorwo githi na haraya ukorwo githara ciana kumana na mautu uhaguku wa mutugo na ohi wada ona makirie muno guthara mwana wa kahi hari gwikuruhania na ciiko cia wiki na makibia kiugaki akina kiuga atiri Roru rwaga njaũ nĩ rwahuka na tũngĩkorwo njaũ iria tũrakorwo tũkĩrera itira na mĩtugo mĩrũngĩrĩru ona rũciũ rwitũ rũtirĩ harĩa rũrĩ ihinda-inĩ rĩrĩ tĩtĩkĩra ngũcokia mũno rũngĩ wa studio kũrĩ mũndũ gwĩtwo Mũmbi wa Nyuike nĩ ha mũhũri wa kwambisha mũndũ gwĩtwo Kĩgũtho wa Mwangi rĩtwa rĩakwa ngĩtwo Ng'ombe wa Maina kũrĩ we Mũmbi
wa Maina kuma mwena ũcio wa Naikuru. Tugithie na mbere riri biacara nyinge irahotometio ni king'uki gya COVID-19 guku bururi-ini urimi wa mimera na kimera ukoretwo ukiyukio na njira nene makiria gicigo-ini kia ubunge gya Subukia kaunti-ini ya Naikuru kuria arimi maugite mimera yo ya dawa ya mirimu itiganite na gukiria mimera yo ni kuramahura njiki kuona iri na bata munene makiria-ini thoko-ini nene cia mabururi ma nanja. Muringi wa Ngure niwe tuhaririirie riboti ino.
Ugithie na barabara ya Naikuru guthie Laikipia kamuruki kega niko karakuguciriria kuingira mugunda-ini uyu wa mimera ya kimerera uria urio matina manini kuma barabara-ini ino. Waingira mugunda-ini uyu kuri na greenhouse ithathatu na o imwe yacio iri na mimera ino ya kimerera thiini kuri na atumia 20 amwe makigetha na aria angi magetha ya metereire kumitwara thoko.
Juu kazi imerudi tunapata faida juu tunapata penye mtu ataamka aende akatafute his or her daily bread.
Murugamiriri wa mugunda uyu Godfrey Wachira aratutaririo na thenge wa king'uki gia COVID kumahutia na njira nene na gucungiriria manyihie namba ya aruti a wira mugunda-ini uyu. Ukoria wa mimera ino ukoretwo uteguthingitha kuona mimera ino ni rabatarania uthondeki-ini wa dawa cia kimerera thoko-ini cia guku bururi-ini na cia nja wa bururi.
Soko already saa imerudi, kwa hivyo tutaendelea kama kawaida na tutaona mafanikio kulingana na kasi yetu.
Thina wa kwaga thoko na makiria cia thi cia nanja ni umwe wa mathina maria magomeire urimi uyu, kuona aguri aingi maumaga mabururi ma Italy na Russia na unathengia wa ndege cia mirigo gukorwo igitikirio kuingira bururi-ini. Aingi aguri acio nio merehaga.
Current telling us that they want the crops, but we don't have any means to take the crops to them or the products to them. Now we are opted to sell to UK and Netherlands where we have the cargoes priced as per now.
Urimi wa mimera ino nduri ureyukio na njira igwete guku bururi-ini, undu uria kuringana na mutaramu wa urimi wa kimerera Ruth Munyoro utumite bururi wa Egypt ukorwo ugitira urimi uyu.
Taking the herbs because kama tunatuma hizi products zikienda huko ng'ambo ndio wanatumia kutengeneza dawa alafu wanatuuzia na bei ghali. What if we embrace this product tuikule as a whole crop? It will be a lot of benefit to us.
Na riu a Kenya ni moritio metekire kuhimbiria urimi wa mimera ino kuona ni undu gukorwo na baita nene hari wendia wa indo nja ya bururi. Ngiribotera Kameme TV, Jetagwo Muringi wa Ngure.
Mwerekeri witu niwe witagwo Chama auga mathaa ma mohoro gitao ni mathira, koguo riu ni reke ndithire turicamania ringi ciarikia kwihanda thaa imwe cia hwaini. Ngatho muno ni undu wa unyitaniri waku, no ririkane wihe hinya Ngai ni aguthondeka njira haria hatari. Jetagwo Mumbi wa Wanyike na mwathiriri na njira ya cikweta wa Gaki wa Muthoni yana miaraho miega.